good afternoon to everyone. It truly is a great honor and pleasure for me to introduce the recipient of the 2015 Award for Distinguished Contributions to the Field of Public Health, Dr. Jane Zapka. Dr. Zapka is a rare and exceptional person in many respects, but especially for our purposes here today. She is both an alumna of the Community Health Education Program, and she served on the faculty of Health Policy and Management. Dr. Zapka is about to publish her 200th peer-reviewed scientific article. She has been awarded multiple millions of dollars in grants from the NIH and the Robert Wood Johnson Foundation, to name just a few, but especially the National Cancer Institute. She has served on the faculty of our own UMass Amherst School of Public Health and Sciences, the UMass Medical School in Worcester, and for the last 13 years, after retiring, at the Medical University of South Carolina. In reviewing Jane's CV and accomplishments for this occasion, some of you in the audience may be amused to hear that Jane started her career when it was then the Division of Public Health under and within the School of Health Sciences. My, haven't things changed. I've spent my career in many respects trying to follow in or just to keep up with Jane in her footsteps. When I was in graduate school, I had a pre-doc fellowship at the Alcohol Research Group at UC Berkeley, where we learned about a nationally renowned model college alcohol education and prevention program being implemented at the UMass University Health Services. This program was developed by this amazing health educator named Jane Zapka under the direction of the UHS director, Dr. David Kraft. A couple years later, I was then quite pleasantly surprised to learn that she was on the faculty here at the school at the time when I applied for my position here. After working as a health educator on campus here, Jane had come to appreciate the huge impact that healthcare services and healthcare systems have on population health. And so she went back to pursue her doctorate at Harvard University in health administration. Seeing her here on the faculty was one of the main reasons I decided to come to UMass. While we were here on the faculty together, Jane taught me many important lessons about being a good faculty member, including important lessons in the politics of higher education. Shortly after arriving at UMass, I was fortunate to gain funding from the W.K. Kellogg Foundation on a project called Community-Based Public Health. And in the chutzpah of my youth, I proposed a new course that would finally show students how the U.S. healthcare system really worked. Jane then gave me one of her withering, "Oh, you poor, pathetic, naive babe in the woods" looks, followed by her unmistakably stern reprimand. "David, our core required course in HPM is titled Principles of Public Health. What do you think we teach there?" It was an important lesson in humility for me, and one that has served me well to this day in dealing with more senior colleagues. She then went on in a brief offhand comment that I often repeat. Health administration has always been about optimizing the trade-offs between cost, quality, and access. It was one of those wonderful moments when a light bulb suddenly goes off because a brilliant mind has so elegantly captured an incredibly complex topic in just a few succinct words. When we moved here from California, we had been warned that it might take a few years, if not a few generations, for New Englanders to warm to us and actually say hello. But defying such stereotypes, Jane hosted some wonderful holiday gatherings at her and her husband David's here too today to join us. Jane and David's gorgeous, beautiful home in Hatfield, and their gracious act of hospitality was one of the first instances when we felt we could make Massachusetts a home for us. And so without further ado, it's a great pleasure and honor for me to announce to you today that the 2015 UMass Distinguished Alumni Award recipient, Dr. Jane Zapka.